Wishing everyone healthy days. One of the most common heart conditions in children, essentially a hole, is a ventricular septal defect. It typically presents as a heart murmur starting in the newborn period, leading to a diagnosis. Very large ones are usually treated surgically around the 6th to 8th month of life. Some are too large for surgery, yet big enough to cause heart failure, but also too small to wait for later stages. We can treat these at intermediate ages using angiography. Ventricular septal defects can have different names based on their location within the heart. The most common are perimembranous holes located in the area below the aorta and pulmonary artery. In addition to those, there are muscular holes which are located closer to the apex of the heart. If we're planning to treat a patient with angiography instead of surgery, what will the child experience and how is it done? I'm going to give you some information about this. The patient you see behind us was a 2-year-old girl with a ventricular septal defect. She was referred to us from another center because the hole was too large and her heart was straining. So we decided to perform an angiography to close this hole. Patients are admitted to the ward a day before or on the morning of the procedure for monitoring. At the scheduled time, we take our young patients down for the procedure. After the anesthesiologists put the children to sleep, they intubate them, placing a tube into the airway. In suitable patients, we use a Transesophageal echocardiography device inserted through the esophagus to evaluate the hole. Once the patient is in the lab, we complete this evaluation, drape them, and begin the angiography. We insert cannulas into an artery and a vein, then guide small tubes into the heart to measure the hole with injections. Next, we select the appropriate device for that specific hole and proceed to close it. We can perform this procedure through either the arterial side or the venous side. We choose the approach based on the location, type, and characteristics of the patient's hole. Here we'll discuss a 2-year-old patient whose muscular hole near the heart's apex was closed via the artery. In this first injection, we're looking at the contrast being delivered into the left side of the heart. In the middle, you can see the wall dividing the right and left sides, showing leakage in 1 or 2 spots. So these are the points we refer to as ventricular septal defects. Our goal is to close these up. After the initial injection, we can clearly see the location of the hole. We bring the catheter from the artery to the hole and pass a wire through it to cross the defect. Then we attempt to advance our catheter across this hole. This particular patient was quite a challenging case. Because of that, we had to use 2 wires. This is known as the body wire technique. Afterwards, we performed another injection. We confirmed that we had passed through the correct spot. This time, our supporting catheter has been changed. These are much wider tubes which we call delivery, through which we can send our devices as we mentioned before. Then we removed these wires and sent our device through this long sheath that we call delivery. Here we open the first part on the left side, and by pulling it back we make it lean towards the right side. As we can see here, our device has 2 discs. We shape it so that the tip disc is in the right ventricle and the back disc is in the left ventricle, and we want the device to return to its ideal shape. Here, after seeing that the position and shape of our device are very good with both echocardiography, which if you notice entered through the mouth and remained above, and angiography, we release our device. We also see that our device, which we see here, has taken its ideal shape. Then we perform the injection again. In the injection, we see that all the holes in the middle that we had seen before are closed. With a different technique we used in this patient, we have also restricted the passages at the bottom by placing the right side disc of our device in the appropriate place. After following our patient in the ward for 1 more day, when we see that there are no problems, we send them home in a healthy way after the control echocardiography. I wish you all healthy days.